People, plants, animals, and things move on a global scale. And with this, many human and animal diseases are spreading across borders. Control of livestock diseases is a nationwide effort for the stable supply of food. Now we introduce control of livestock diseases in Japan, which has stopped the spread of many livestock diseases on a large scale so far. First, let's describe how control of livestock diseases works as practiced in Japan. Japan protects livestock from infectious disease epidemics at 3 levels. First is the farmer's level. Appropriate hygiene management and early reporting are obligations for livestock farmers. Next is the region level. Livestock hygiene service centers are located in 168 places in 47 prefectures to provide services such as infectious disease diagnosis and hygiene guidance. The national government provides legal arrangements in order to prevent invasion by livestock infectious diseases from overseas. Animal Quarantine Services of Ministry of Agriculture, Forestry, and Fisheries conducts import and export quarantine of animals, restricts the entry of livestock products and processed livestock products, and disinfects shoe soles using disinfection mats at airports. The National Institute for Animal Health of the National Agriculture and Food Research Organization conducts research on prevention, diagnosis, and treatment of livestock infectious diseases and makes definitive diagnoses of samples sent from livestock hygiene service centers. Farmers are the first to deal with any abnormalities found in livestock. All the farmers contract with their own veterinarians. We spoke with one of those veterinarians.
普段、農家さんはご自身たちで病気の治療をされることも多いんですけれども、それでも手に負えない、もしくはこれはちょっと自分たちじゃ難しいなと思う症例に関してはもう発生したらすぐ獣医師に診療の依頼の連絡が来ます。でそれは地元の開業している先生であるとか、あとは家畜共済組合という、保険に入っている農家さんであればその共済組合の先生が診療に来てくださいます。
A primary veterinarian will visit a farm immediately upon request from a farmer to examine and treat animals and provide advice on preventive measures. The farmer must report quickly and accurately when an infectious disease is suspected.
重要な疾病に関してはまずその家畜保健所に届け出の義務がありまして、で家畜保健所からさらに都道府県、さらに国の方に報告が入ります。でそれは一つの法律の中に、2種類の大きな病気の、カテゴリーが分けられています。で届け出伝染病というものと家畜伝染病という2つ合わせて監視伝染病というふうに呼ばれるんですけども。
A primary veterinarian is contacted when a livestock farmer detects an abnormality. If they suspect a monitored infectious disease is suspected, the veterinarian contacts the Livestock Hygiene Service Center. Veterinarians from the Livestock Hygiene Service Center will rush to the scene to investigate the outbreak and collect samples, examine, and diagnose. Monitored infectious diseases are reported to the national government by the prefecture. Domestic animal infectious diseases, such as foot and mouth disease and highly pathogenic avian influenza in particular, are reported promptly to the national government by the level at which they are suspected, and definitive diagnosis and preparations for culling proceed simultaneously in parallel. Measures to prevent invasions of malignant infectious disease are taken quickly and accurately with the 3-level system, consisting of livestock farmers, prefectures, and the national government. This livestock diseases control system is supported by law with the Act on Domestic Animal Infectious Diseases Control, which is intended to promote the livestock industry by preventing outbreaks and stopping the spread of infectious diseases. Now let's look at the history of development of the livestock diseases control system. The impetus for Japan's livestock diseases control system was rinderpest, which was epidemic in the regions of Manchuria and Siberia. As damage spread with the invasion of rinderpest into Japan, regulations were issued at the regional level and laws were enacted. Since then, it has been possible to deal flexibly with many diseases based on the Act. The current Act on Domestic Animal Infectious Diseases Control has been amended many times for various infectious diseases that have hit Japan since 1951. We have strong cooperation and legal arrangements between sites and governments. Nevertheless, infectious diseases continue to occur. Various types of domestic animal infectious diseases have occurred in Japan in recent years. Highly pathogenic avian influenza, for example. In 2004, outbreaks were confirmed in Japan for the first time in 79 years. While roughly 300,000 birds were slaughtered nationwide that year and things settled down, it has occurred sporadically since then. When highly pathogenic avian influenza occurs, there is not only direct damage, but also impacts such as a drop in demand for chicken meat. The total damage has been calculated at more than 13.8 billion yen just from January through April 2004. Foot and mouth disease for another typical example. Japan is free from foot and mouth disease, but this virus jumped the barrier of international border quarantine to enter Japan in 2010 and caused the outbreaks for the first time in 10 years. Roughly 300,000 cows and pigs were culled to prevent the spread of infection and restore Japan as a disease-free country. It has been reported that recovery took 3 years and that total damage amounted to 235 billion yen in Miyazaki Prefecture alone. We spoke with Dr. Ikeda, who worked in a neighboring prefecture during the outbreak.
当時鹿児島県で勤務してたんですけれども、鹿児島県でもその口腔内、口からよだれを出しているかとか、口蹄疫を疑う症状があった場合は、速やかにやはり家畜保健所の方に届け出を何回かしました。でその場合はやはりもうその発見したらですね、その場でもう農家さんも獣医師も実際に家畜保健所の先生が来て診断が出るまで動けないんですね。他の農家さんに行ってはいけませんというのがありました。
When a major domestic animal infectious disease occurs, national and prefectural governments, as well as relevant regional bodies, collaborate on things such as prohibiting movement of livestock, mobilizing workers from other prefectures, and the self-defense forces for culling and burial work, restricting traffic, and disinfecting ordinary vehicles. What changes to the infection prevention system on farms were spurred by the foot and mouth disease outbreak?
で家畜保健所としても、指導したのはですね、まずは牛舎の消毒なんですね。で無駄な人の立ち入りの禁止、この2つを農家さんたちは徹底されました。そうするとやっぱり不思議なことに感染症病気って出なくなるんですね。なので、病気の予防というと、ワクチンであるとかいろんな抗生物質を餌に混ぜるとか言われがちなんですけれども、基本的にはやはりもうベースは不必要な人の立ち入りを制限する、なおかつ牛舎の中を常に清潔に保って消毒などを併用するということがもう一番の伝染病の予防効果があるのだなというふうにすごく感じました。
Currently, it is mandatory to keep a record of names, date, and time when entering farms for epidemiological investigation in case of disease outbreak, and to change and disinfect boots when entering barns. This is how invasions of livestock infectious diseases are prevented at the farm level. Japan's livestock diseases control system is expanding overseas. Since 2008, there has been a lot of livestock movement across borders, and assistance has been provided with focus on the site level in Cambodia, Laos, Malaysia, Myanmar, Thailand, and Vietnam, including the establishment of technology for livestock disease diagnosis, reinforcement of livestock hygiene guidance to farmers, and establishing systems for rapid communication and reporting of livestock diseases. Protecting livestock from infectious diseases in livestock spreading across borders is impossible with border infection prevention by a single country. Therefore, JICA has been supporting technical cooperation in projects in various countries to control and respond to livestock diseases, with the world unifying and many countries cooperating to share information going forward.